Hello guys, welcome back. This is the last one. All right, hospital pharmacy part 2 of 2, the last one in phase 1 of education 4.0. All right, the Unidos system, as you recall from part 1, that is the 24-hour system. So whatever they need for tomorrow, we need to fill today. So in the nurse's station, in a secure area, you might have a drawer like this, and patient's name, room number, and all their drugs they need for tomorrow, today, are all placed in there. So what should you place in the patient's cassette? So Unidos items, so here's a suppository, that's fine, and ampule, little tiny drug vial. So these are your unit dose tablets and capsules. But what else can you put in there? You can put in their inhaler, so their meter dose inhaler. Sometimes a patient will have a bulk cream or ointment, a tube of that, just for them. So we'll keep that in there. So we'll call those the bulk items. You can also have unit dose cups of solutions. So they'll measure out 5 mLs, 10 mLs, etc. So every day you'll need to exchange the cart. Anything the patient didn't use, you'll need to credit and replace with tomorrow's meds. So most of the time we'll put the PRN meds and anything else that we want in the dispensing machine. So now today in the patient's cassette there's very minimal drugs. Usually it's just going to be the specialty items. You'll get a notice from the automated dispensing machine if it has low stock. So here's the Unidos system area where you're going from bulk package to Unidos. So you'll need to use the printer to print your repackaged label and assign your repackaged expiration date and lot number. So you can also have this automatically fill your patient cassettes as well. So just imagine a robotic arm pulling meds from this area and putting them in the correct patient drawer in this area. So the pulling drug part can be done for you. You'll just need to verify it with the pharmacist before you exchange the cassettes. Communication. A lot of hospitals still use these pneumatic tubes. So via air pressure, you can send communication and even drugs. You can send some drugs, and sometimes they'll send lab specimens as well. So make sure that the drug will be able to fit, right? So small drugs, of course, no narcotics, and nothing that's fragile, like let's say insulin. So insulin, if it shakes a lot, it'll bubble up, so it'll damage. And it's in glass, it might break. Other communications you'll get, a lot of times voicemail. So the number one error, or the number one factor contributing errors to the pharmacy, are interruptions from phone calls. So if you can limit phone calls, use our technology, it will help limit errors. So in a lot of places they'll implement, if you need a drug, leave a message. That'll help with the interruptions. You'll get your orders in via fax or written, computer, scan, email. So a lot of ways you'll get communication, and a lot of different automatic notifications. We just mentioned one with the automated dispensing machine stockouts. You'll get a notification if it's low or almost out of stock. When a patient is transferred from the emergency department to the hospital, you'll get a notification because you'll need to now fill those meds for the patient. What else would you get automatic? Discontinued drugs, transfer of patient from room to room. So a lot of things you'll get an automatic notification for. Like anything else, you'll use the computer system. So you'll have the pharmacy system, and then you'll also have the hospital system. So the hospital system is the global database of all patients that are currently admitted to the hospital, and you also will have data on past patients. And additionally, you'll have the pharmacy drug order entry system and access to that as well. If you're ordering, you'll need to have access to vendors ordering system. Well, that's a third one. And then if you have an automated dispensing machine, then guess what? That's going to have its own computer system as well that you'll need to access and use. What type of medication should not be sent by the air tubes, the pneumatic tubes? So we mentioned too big. So if you have a 1 liter bag, don't send that. Maybe up to 250 is the largest that I'd send. If it's a narcotic, definitely. And lastly, insulin was my example, if it's unstable or fragile. What type of drugs are placed in the patient's medication cassette? So technically anything, so any tablets, capsules, but nowadays we want to avoid PRN meds, and it's really limited now to just what they can't pull from the automated dispensing machine. So inhalers, meter dose inhalers, bulk items like insulin that's special to them, creams, ointments, but most of the time anything PRN, anything routine, we'll put it in the automated dispensing machine. How are medications organized in the pharmacy? Well, similar to retail, alphabetically by generic, and these are based on dosage form. Dosage form and route. Who determines the hospital formulary? So we have a committee. They are the P&T committee, Pharmacy and Therapeutics. Give an example of an automatic notification sent to the pharmacy. So new prescriptions, new orders, you'll probably get voicemail, stockouts, transfers, discontinued, ED to hospital. Yep, ED to hospital transfer, stockouts, discontinued med. So a bunch more you can think of. True or false? All hospitals have satellite pharmacies. Well, if you're a tiny one, you may not even have a 24-hour central pharmacy. So that's false. So mostly the larger and modern day hospitals will have satellite pharmacies. Medical records. So in the hospital, we'll use the 24-hour clock. So try not to use 0000. So we'll use 0001. And for the other extreme, we'll use 2359. So here it's kind of incorrect. You don't want a colon. So 24-hour clock is just the 4 digits, no colon. Medication charts. So make sure you're familiar with what's in it. So we'll have their electronic health records, and then we'll also have their electronic medical record, and then we'll have their chart. So these terms might be used a little bit differently in your setting, but usually for that visit, they'll have a patient chart. So that used to be the clipboard that's at the foot of the patient's table, or sorry, foot of the patient's bed. But nowadays it's electronic. It's in that computer that's in the patient's room. So for the facility, we'll have access to the hospital's electronic medical record. And if it's a larger institution, you might have access to the patient's entire medical history. So the electronic health records of the patient from multiple facilities. So not just the hospital, but also access to everything at the doctor's office, at the surgical center, anywhere, right? So that's their electronic health records. Medication orders. So instead, like retail, where we have a specific prescription pad for that doctor, in the hospital, we'll just have a generic blank one, and all the doctor's information is on file. They just start writing, and as soon as they sign it, then that becomes a legal document, a legal prescription. The goal of the pharmacy staff is to interpret everything and then respond to what are the drug orders. So in this case, there's a penicillin allergy. They're going to need some normal saline and then some Tylenol. Right? So we'll have to input those types of information. For the nursing staff, anytime they administer the drug, they'll need to document it on the MAR, the Medication Administration Record. So the pharmacy will supply the staff, the medical staff, with the MAR, and for drugs that are scheduled, usually they'll be printed with the scheduled times. For drugs that are PRN, like acetaminophen, when the dose is given, the nurse will specify the time. So this looks like it's a new patient, brand new MAR from, because nothing is pre-printed. Everything is handwritten in. Prepping the script. So similar to retail, as soon as the label starts, or the printer starts producing labels, you want to check them, and you'll need to determine if you need to fill the drug now or wait until it's scheduled. So that's probably the hardest thing for a new technician in the hospital, is to determine which drugs do I want to fill now and send now, and which one can I wait for their scheduled time. Final check by the pharmacist once it's filled, but as mentioned earlier, 9 states currently allow technicians to check technician, and then that drug will go to the patient. So hopefully that expands a little bit further, maybe more requirement, like passing or getting certification and additional training, but at least that'll expand the scope of practice for technicians. The number one question you'll get from the nursing staff: where is the medication I ordered? And to answer this question, you'll need to know the source of the medication. So how can the nursing staff access the medication? So the easiest answer, or the easiest source, is if it's a pharmacy source. If the pharmacy needs to physically supply this drug, deliver it, then you'll just let the nursing staff know, hey, that's a drug, I'll get it to you, I'll deliver it to you. The other source that the nurse can get the medication is from the machines, the automated dispensing machines. So in that case, you'll tell the nursing staff, hey, you're going to need to pull it out from the Pyxis machine or the MedRx machine. Right? Your job then is to make sure it's loaded in that machine and it's not out of stock. And lastly, the drug might be a floor stock item, something readily available. So just direct the nurse towards that. An example would be normal saline flushes. So it's just normal saline, about 10 mLs maybe. So when you give anything IV push, you want to make sure you clean out the tubing before you administer the drug. So this is going to be readily available. It would be a pain in the butt if the pharmacy had to deliver it or the nurse had to pull it every time. Purchaser or buyer, very prestigious job. You're going to be working usually banker hours whenever the vendors are available. So you set your par level, your periodic replenishment or periodic automated replenishment level. So that means you set a maximum level, a min level, and once your stock reaches your min level, you'll know to restock to max. So if it's done correctly, it works perfectly. but if you skimp on any procedure, you might be ordering too much or too little of a drug. Receiving narcs, so a technician can, but make sure you check everything, because once you sign for it, um, you're responsible for it. And you can't readily return any C2s because of the DEA Form 222 requirement. Disposal will require a second witness, and until the DEA trusts you, you may have to save everything until you can then just discard it. Anytime you have a shortage, especially during the flu season, Tamiflu is usually out of stock. It's a viral medication. If you take within 72 hours of flu symptoms, usually you don't develop the flu or a very mild case of it. So just watch out for any recalls. So usually it is lot specific. So just check the lot number that is affected. For disposal, you might have to save it and return it to the vendor or manufacturer, but make sure you document everything. So keep this in a binder, already available if you ever get audited. So if you unit dose from a bulk bottle, make sure you keep good track of your lot numbers, so you only pull the affected lots, and it'll save you from pulling everything. In emergency cases where you're out of stock and you need it before your next delivery, you may need to borrow from another hospital. Just document it, return them the same meds, or give them the value of the medication. Sterile product preparation. So since implementation of USP Chapter 797, all the regulations are now required. You need a clean room, and you need your hoods, training, and certification of all your equipment as well. So you'll make some small volume parentals, large volume parentals, total parental nutritions, and even chemos. Right? So you usually give the first dose right away if the patient just got admitted, and then just like the Unidos system, we fill for a 24-hour supply in the hospital. Single dose vial versus multi-dose vial. Single dose vial will be preservative free, and multi-dose vial will have some kind of antimicrobial agent, so you can use those again and again. Whereas single dose vial, it might be limited to maybe just 2 hours after first puncture. Epidurals and intrathecal, so they're going to be entering into the spine. So the epidural is right above the dura mater, and then intrathecal, we're going to enter past the dura mater into the spinal cord, so accessing the cerebral spinal fluid. So definitely you want to make sure you use single dose vials for that. 2-in-1 TPNs, total parental nutrition, that contains sugar, dextrose, and amino acids. Those are usually 2-in-1. If it contains also lipids or fats, they usually call that a 3-in-1. So if you take a look at the setup, the most dangerous IV compound or most dangerous drug therapy, just count, there's about 25, 30 ingredients, so 25, 30 chances of you making a mistake, mixing up volumes, contaminating. So this production can get kind of complex. So the better, more experienced technicians and pharmacists will be involved in TPN compounding. So difficult that most hospitals will outsource their TPN compounding to a specialized IV infusion center. Agencies that you might come across. So the Joint Commission, they changed their name multiple times, but now they're just known as Joint Commission. So these will be the main auditing organization for hospitals. So they'll audit every area, not just the pharmacy, but the operating room, the kitchen, the outpatient pharmacy, everything. CMS for Medicare and Medicaid services. And usually the Board of Pharmacy and these guys don't come in unless these guys throw up a red flag. Crash carts. So responding to code blue, that is adult cardiac arrest. For child, that's usually code pink. So depending on your hospital, they might have different codes, but they're usually similar from hospital to hospital. So we need to send at least one technician and one pharmacist to respond. And usually the crash cart, we might have to send from the pharmacy, or there's one on the floor. So there's no room for the pharmacist, so they'll be straddling the door. So they'll be right here in the doorway. And whatever the doctor calls for verbally, they'll verbally relay to the technician. So the technician is way out here in the hallway with the crash cart, ready to fill the meds. And once the technician fills the order, they'll hand it to the pharmacist, verbally calling out what it is. And then the pharmacist will hand that to the doctor or the nurse, verbally calling out what that drug is. We don't have time for labeling. And if need be, they'll administer that drug right away. So you may need to respond. So if you're doing an externship or in the hospital area, make sure you get a chance to observe response to a code blue. And lastly, safety. Now they're just called safety data sheets, and most places have them electronically. So make sure you know how to access that on your computer program. And that's just for safety. There's a lot of different waste streams in the hospital. So we have sharps, we have biohazard, we have chemo waste, we have chemical waste, we have drug waste. So make sure you dispose of the waste in its appropriate waste stream. All right, let's get into some review questions. NKA versus NKDA. So no known allergies versus no known drug allergies. So we might know some drug allergies, but if you have food or animals, pollen, anything else, we might not be familiar with those. So there is a small difference. MAR, that is the medication administration record. Very good. What is the turnaround time for stat order? So this is for emergency versus PRN or ASAP, right? So stat orders, get them 15 minutes, hand delivered. Let them know if they're going to come or you need to deliver it. ASAP, usually for as needed meds, patient not life-threatening, or it's routine. So up to about an hour, but still try to get them as soon as possible. So what is the turnaround time for ASAP orders? About an hour. So stat, 15 minutes, ASAP, 1 hour. What does PAR stand for? So PAR is when you set your max and your min levels, and once you reach your min levels, you're going to reorder. So that's your periodic automatic replenishment system. What system is used to fill IV meds in the hospital? Well, same as Unidos. We use the 24-hour fill. So that means today we got to fill all IVs for tomorrow. Of course, don't fill the unstable meds or the short-dated meds. Those you're going to have to make throughout the day when needed. Okay, that concludes hospital pharmacy and concludes part 1 or phase 1 of Education 4.0. So all the lectures are loaded. All of the math and SIG code lectures are loaded. So thank you everyone for joining us again, and I'll set up a live session to make that big announcement. So that's coming up soon. Watch out for that. You guys all have a wonderful week.